What's up, everybody? Welcome. Listen, ADHD is hard enough. Okay. It's hard enough to know how to deal with it, how to proceed, how to live, how to organize. But you know what shouldn't be hard? What to do about it. We all know about medicines. We all know about all the stuff. But what about natural interventions? If you have those questions, this is your day. This is your video. We've got answers. Welcome to the show. Oh, yeah. Oh, yeah. Welcome to the show. Natural interventions, treatment for ADHD. Okay, we're going to demystify this today. Today, we're going to gather around the campfire. Okay, we're going to gather around the campfire. We're going to warm our hands and tell tales of things that are true, that actually happened, right? Evidence-based best practice, natural interventions that actually work. And then we're going to tell some myths. We're going to talk about some stuff that doesn't really work. We're going to talk about Cujo Joe and the spooky old crazy guy who lives in the woods. We're going to talk about that too. And about how, look, there's probably not a lot of value in that story. Okay, that's a myth. And I'm going to tell you and teach you how to tell the difference. For those of you who are new to the channel, welcome. This is Developmental Behavioral Pediatrics Live. I'm Dr. Nate Noble, developmental pediatrician, clinical geneticist, and self-proclaimed internet sensation. Okay. I don't know why I say that. Okay, let's get started because I don't want to waste your time. All right, let's get going. Here's what you have to understand about clinical decision making. Okay, if you're trying to make a decision about whether or not an intervention is right for you, you have to ask questions about three different areas. Okay. First of all, what does the research show us? And we're going to talk about that today. I'm going to give you a real quick pull back the curtain, unlock the doors of academia, and look at how do you make decisions about what is evidence-based best practice and what is not. Think about it like a layman's guide to evidence-based best practice. We're going to do that today. Okay. We're also going to talk about clinical expertise, because sometimes you make these decisions about what's best for patients or families based on what you know works clinically. And then lastly, and never undervalue this one, patient values, right? Not everybody comes to me and says, hey, look, I got ADHD. You know what I really want? A medicine made in a factory. I want one of those. Where you got the medicine in factory ones? Give me those. Now, there's a time and a place for that. Do we prescribe these medications? Yes. Are they incredibly effective? Yes. But that's not what we're talking about today. We're talking about complementary and alternative medication strategies. But you have to understand that the reason why this hasn't worked its way into, everyday practice is because the research can be limited. It's hard to measure. There's funding gaps. There's cultural and historical roots that kind of can cloud some of our judgments in regards to what we think about ding dong and what we think about melatonin, things like that. And so we have to kind of find a way to weed through that, knowing that we're going to have to make the best with what we have in terms of data. And in order to do it, in order for you to demystify this process and make the right decision for yourself, I have to give you handlebars. Handlebars, okay? One of my mentors taught me that in order for people to get a sense on how to navigate through difficult or complicated issues, you got to give them handlebars, and that's what we're going to do. And there's two handlebars I want to give you as you try and think about what's the best alternative and complementary medication strategy for you or your child. Here's a couple of handlebars I want you to think about. I'm going to make this big so that we can look at it because this is important. Okay. All right. Here is the evidence-based criteria. All right. Now you've seen some semblance of this before, but you need to understand this because if you're trying to make decisions in regards to what's best for your family or for yourself, you have to have some kind of handlebars on how to sift through the information that's available. Okay. When I was a kid, my dad would go to the grocery store and we'd be in the checkout line and he'd always want to buy the National Enquirer. Okay. Now the National Enquirer is a periodical. A lot of great news, a lot of insightful things are published in the National Enquirer, but most of the published stories about Bat Boy. Okay. There's a boy, he's half bat, half boy. They talked about it in the National Enquirer. And while that's information printed, maybe not super trustworthy. No offense to the National Enquirer, but maybe not something you want to base your investing advice on or how you should parent from the National Enquirer. But then there's other pieces of information like, at that time, like the Wall Street Journal or the Journal of the American Medical Association, JAMA. These are other periodicals, other things that are printed, but are to be trusted. Okay. So when we look at this chart down at the bottom here, I'm going to make it big so you can see this guy. You got this spooky prospector guy who's got a basket full of eggs. Okay. He represents the lowest levels of support. And as we go through this and we look at the different interventions, we're going going to look at it on this pyramid, and I'm going to show you where the data lies. Is it closer to the spooky guy with the basket full of eggs, right? The National Enquirer of information, or is it closer to the top of the pyramid where the bar of gold lies? Okay, let's make it big again. So let's talk about it real quick. At the bottom, you got editorials, expert opinions, right? This is personal or professional opinions, right? Then you've got case series or case reports. Now, those are single patient or small group experiences. Now, listen, you know what I'm going to say. A lot of what we're going to talk about, a lot of the things that you've heard in your friend group or on Facebook or things like that are probably going to be individuals with an individual experience, okay? They're going to represent kind of anecdotal evidence about things that they tried themselves or them and that they and their family may have tried that worked or didn't work. That's going to represent case series or case reports, which, as you can see, is low on the pyramid, okay? Next up is case controls. Case controls compare people with a condition to a group without the condition. So as an example, smokers versus not smokers, who gets cancer, who doesn't, and what's the correlation? So that's case control studies. So we're working our way up the pyramid. Next is cohort studies. Cohort studies are things like following a group over time. So it's non-randomized. It's a group of people, say they drink tea, and you follow tea drinkers for 20 years and you see how many of them develop prostate cancer. That's a cohort study. Then you've got randomized controlled trials, or RCTs. Now, those are comparisons between groups, okay? And an example of this that you'd be aware of most likely would be placebo-controlled trials. So an example is both people are getting a medication, but the pill looks the same for both groups. They're matched by age and race and comorbidities, but one pill is a sugar pill and one pill is a medicine. That's a randomized control trial. So as we go up this pyramid, you can tell the data that you get as you go up the pyramid it just makes sense. It's more trustworthy, right? It's more towards the gold, less towards the spooky guy with the basket full of eggs. And then lastly, we have a synopsis, kind of like a greatest hits. That's systematic reviews and meta-analyses. And these are greatest hits. They summarize all the best of the things below them, and they throw out the ones that weren't done well. Okay. And they standardize which ones are in and out based on admission criteria, and they summarize it for you, kind of like a Consumer Reports. Okay. And so that's the highest level of information, is a synopsis of all the greatest hits of all the albums of all the artists. Okay. So that's the gold. And then that's the spooky prospector. That's one of the two handlebars that we're going to discuss as we go through this. The next handlebar that I want to give you to try and make sense of all the things we're about to get into is the Nate Noble rating scale circa 2025. All right. If you see a prospector, it's a nope. Okay. Nope. No, thank you. Maybe there's just not enough data to support it. Maybe we'll find out in a year it's the right thing. If you see a gold bar next to these different things we're going to discuss, that's why not? Why not? There might not be overwhelming data to support it, but there's enough, and it might be easy enough to do, and it's not super expensive, and it's safe, and it makes sense. So why not try it? Okay. That's the two handlebars for our time together. Let's talk first about elimination diets. Remember, today we're talking about natural interventions for ADHD. I don't want you on a medicine any more than anybody else, right? I don't want medicines for people if we can avoid it. Do they work? Yes. Should they be considered? Yes. But not before we run through the steps. And the steps always start with smart choices in regards to alternative and complementary medication or intervention strategies. Elimination diets. Okay, here is what you have to know. Okay, in the 70s, there was a book that was published. And here's the book. I'm gonna make it big. It was Why Your Child is Hyperactive. It was by a doctor, Dr. Feingold. Dr. Feingold was an allergist, okay? Put together a book and said, listen, if your child's hyperactive or impulsive, I got some reasons why that might be. And lo and behold, in the book, he says, there's two big problems here. You know what the problem is with your kid? You know why they got hyperactivity? It's artificial food additives and naturally occurring salicylates. And when you remove those things from foods, according to my buddy, Ben Feingold, he says, you know what? 50% of the symptoms are going to get better. Okay. Now, this was what you could think about, first to market idea, right? First to market idea that there's an intervention that we could utilize that would dramatically shift the hyperactive, impulsive, and attentive features of ADHD. And it's something that you can do at home. It makes sense. The book sold a lot of copies. So there's just one problem. Okay. Salicylates All right. As my man, Ben Feingold says, salicylates, you just take those out of the food. No big deal. Everything's going to get better. Well, guess what? Salicylates, naturally occurring salicylates, are substances that can be found in a lot of things like legumes, the old peanuts, beans, right? Vegetables, fruits, herbs, spices, all the things that keep me alive. Okay. So, I mean, that's what he says. Pull that stuff out. All right. But not only that, but wait, there's more. Let's talk about getting rid of additives. Now, this part of it, nobody disagrees with this. Okay. Nobody disagrees with this. But there's three kinds of additives. There's natural substances like beet juice, like people put beet juice and stuff to make it turn a certain color. But then there's natural identical additives. So it exists in nature, but it's also made in a laboratory, like ethyl acetate. And then lastly, there's ethyl maltol, which is straight up artificial. And of course, nobody wants. All right. So I don't disagree with the additive part, but the salicylates part, I mean, come on, that's a little dicey. But here's what you got to understand. This is a TV dinner. Okay. TV dinners were ingested by the majority of my compadres throughout the entire 1980s. And I'm going to tell you, the 1980s was an interesting time. If you didn't live through it and you build a time machine, go back there, because I'm telling you, it's absolutely fantastic. A lot of neon, a lot of interesting stuff. But the thing about it is that we all ate that stuff. I grew up on a farm, and so my mom was always making stuff up from scratch, but so I thought I was missing out. But all my friends were eating TV dinners, and they're doing fine. They lived a good life, right? They're not like they're doing okay. So if Ben Feingold's hypothesis is true, then man, we should have seen a lot of it from the 80s, right? But here's the problem: when they studied this at the highest levels in 1983, they came out with a systematic review. Or a meta-analysis, or both, I can't remember. And essentially what they found was there's really no data to support this, right? As a general rule, when you're climbing up the pyramid of data, the replicability of what you're finding increases, and the generalizability, if that's a word, it generalizes, it applies and appeals to more people. I can repeat it in there, you can repeat it in Sweden, and lo and behold, we get the same results. Well, they didn't find that with my man, Ben Feingold, and they said, thanks, but no thanks. Don't waste your time removing legumes and additives from foods, because I don't think it's going to give you the 50% reduction like our man said. So you're thinking, okay, that's the end of the story. Wrong-o. Anybody who's been watching the news over the last 2 days knows we're not done talking about food colorings and preservatives, right? So let's talk a little bit about this, okay? So after they closed the books on the Ben Feingold stuff, 20 years goes by, people are like, eat what you want. Maybe we shouldn't smoke, but let's live our lives. So, but then this idea of food coloring and preservatives comes back into vogue. So now we're into the, late 80s, early 90s. And they do a study called the Southampton studies. And there's this little area, I'll make it big, south of Great Britain. There is an island, and there's an area on the island, or I guess the Southampton is on Great Britain, but just south of that, there's an island called the Isle of Wight. And they did a study there with children, both preschool age children and children 8 to 10 years of age. And what they did was they said, let's pull out food colorings and let's pull out sodium benzoate, which is a preservative. It's an antifungal and antibacterial, and it's a preservative. Okay. Let's pull out these things and see what happens when we do that. We've got this kind of, protected population base. Let's see what happens when we do it. And lo and behold, in the meta-analysis, they found effect sizes that were statistically significant. So for those of you budding statisticians out there, I know this is more than you signed up for. You're like, I don't care about this. Okay, well, just stick with me. This is a handlebar. We need to pay attention. When you're talking about effect sizes, when you're talking about, a meta-analysis as an example, this kind of study that aggregates all these different studies together and gives you a number that tells you about if things work or not. You have to have an effect size that's over a certain threshold. So 0.2 is a small effect, right? 0.3 is the cutoff for significance. And then once you get past 0.3, you're paying attention to what you're finding. The bigger the number, the bigger the effect size, the more important their information is, the more likely it's significant, right? Well, what they found is with preschoolers, they had an effect size between 0.5 and 0.8. In 8 and 9-year-olds, the effect size was smaller, but at the very least, we learned maybe we should pull this stuff out of some food. So this one is going to get a gold bar. Okay. So if you're thinking about alternative medication or alternative strategies that you can use, and you're like, well, what do I do, Noble? Start with this one. Remove preservatives, remove dyes from your child's food. Now, I get what that sounds like. That's not easy to do, right? We want you to shop around the outside of the grocery store, not in the guts of the grocery store, but it's expensive. It's time consuming. It requires a lot of hands. I'm not blaming you. I'm not judging you. We all survived TV dinners. So I don't think that your outcome is going to be deleterious or, miserable. But at the end of the day, it's something that you can do. But let's not forget, we've recently found out in breaking news, red dye is mucho bado. Okay. Surprising approximately 0 people. Now, here's the interesting thing. If you look at Europe and you look at the number of dyes that they allow into their foods, it is much less than ours. Okay. I think they have 6 or 8 different dyes that currently are usable or in production in the United States that have been banned in Europe. And I think red dye 3 was probably one of them. So we're catching up, but man, this is no surprise to anyone that we're starting to get rid of dyes in foods, and certainly preservatives is coming quickly. Now, let's talk about this one. You've heard about omega-3s. Fish oils. Let's talk about fish oils. Noble. Fish oils seem good, right? Let's try some of those. Let's get some of this food. Let's get some salmon and all this stuff. Here's where this stuff comes from. There's a study done on the frontal cortex of rats. And what they found was rats that were especially hyperactive and impulsive had a deficiency in omega-3 as recorded in their frontal cortex. I don't know how they do that. I don't want to know how they do that, but that's what they said. They also found that there was a deficiency in omega-3 on the red blood cells of individuals with ADHD. So there was some precursor data to suggest that maybe there's something to be said about omega-3s. But look at this. This is interesting. Omega-3s. Okay. Omega-3. So EPA, DHA, there's another one. I can't remember. There's like 3, but omega-3s are a type of substance that is widely understood to be popular in Mediterranean diets. Okay. Now, Mediterranean diets are rich in omega-3, and omega-3 is a precursor to anti-inflammatory markers in the body. This is true. I'm not making it up. I'm saying it. You've heard inflammation. Everyone's heard about inflammation, and this is where this kind of data comes from. So the precursors to anti-inflammatory markers in the body are downstream revenue from the ingestion of omega-3s. But look at this. When you look at the Western diet, okay, Western diet is heavy in omega-6. Okay. Now, omega-6 is a precursor to inflammatory markers in the body. So the downstream revenue of a Western diet is inflammatory markers, inflammation. Okay. So we know it's interesting that there may be high omega-3s may cause some anti-inflammatory response to the body, and maybe that's useful. So when we look at the highest level of information as it relates to omega-3, supplementing the diet with omega-3 has been shown to be useful at the highest levels of data. Okay, so it gets a gold bar. So far we've seen some spooky prospectors where all you get is a basket full of eggs. We've seen some gold. And at the end of this video, we are going to summarize all these things for you on a few slides so that you can just take a screenshot of it. But here's something I want you to remember. When you're thinking about how to supplement omega-3s, this is a common question. People have this, well, how do I supplement and how much do I take and how much is too much and blah, blah, blah. Here's a good rule of thumb, okay? When it comes to supplementing your diet, EPA, okay, EPA is a type of omega-3 that is dose dependent in regards to how much benefit you get based on how much you're taking as it relates to ADHD. So one study demonstrated that if you're taking it greater than 550 milligrams of EPA, in addition to a base level of DHA, so 150 milligrams, so roughly 3 to 1, that's where you're going to be in the sweet spot. That's how you know that you're getting enough omega-3s to actually move the needle and make a difference, right? No one wants to just lick omega-3 and be like, well, I feel like I should be getting better. Well, you got to take enough of it, okay? One more thing. If you're like, well, my kid or myself won't take giant, gelatinous, disgusting pills full of fish oil, good news for you. The bioavailability of omega-3 is astronomically higher in just eating foods that contain omega-3. So you've got like flaxseed and fish, of course, fish, so salmon, natural caught, cold saltwater fish tends to have a lot of omega-3. So barracuda is an example as well. So just FYI, if you're in the Costco and you see some barracuda, pick it up. You're going to have a great day, maybe the best day. How about sugar-free diets? How about those? What does the data show us about a sugar-free diet? Now, listen, if you're watching this, you're thinking, well, I don't care what the data shows. Let's get rid of sugars. Like, how good can that possibly be for children? And what I'll tell you, you are not wrong. Like, look at this. This looks delicious, right? For a holiday spread, everybody wants to munch on some sugar. But the bottom line is, when you look at the data, okay, when you look at the data, it can be kind of mixed. There's a lot of confounding variables, right? There's a lot of other things that could confound the results that you get with a presence or absence of sweets in a diet. But a positive relationship was observed. And when you have a situation where 1 out of 5 children in the United States can be considered based on their growth as obese, I think that whatever we do to decrease that problem or to decrease the rivers that flow into it is a good idea. So, of course, when we think about the removal of sugars, that's going to get a gold bar. Yeah, the data supports it loosely. Okay. I don't want you to think that you can go out and find a systematic review or a meta-analysis that is dramatic in pointing out absolutely that ADHD is, absolutely linked to, sugar consumption. You're not probably going to find that, but there is some positive causal relationship that's been established, and certainly removing sugar is never a bad thing. So if that gets a gold bar, that's a why not? Why not? If you can minimize processed foods, if you can minimize sugars in the diet, what I want you to understand is that it will move the needle. Things will improve to some extent. But just because your child eats a cracker or licks a lollipop one time, I don't want you to think they're going to fall off the wagon and all is going to be lost. I don't want you to get so obsessed about following a diet that every time your kid has a bad day, you assume that their body is unable to buffer to any extent. Now, is it different with gluten, casein free and stuff? Yeah, of course. If you've got gluten insensitivity and you eat some crackers, it's not going to go well. So there's exceptions to these rules, but I just don't want you to be so dogmatic that you're like we have a puppy at my house. We have to follow it around all the time because it always does dumb stuff. I don't want you to feel like you have to do that with your kid with the diet when they're at a birthday party. You know what I mean? Let them live their lives. They're going to be fine. But in general, remove that sugar. It represents the highest level of support. Even though it's not overwhelming, it's still something to consider. How about vitamins? Hey, let's go get us some vitamins or vitamins. Let's get some vitamins. Let's go to Whole Foods. Let's go onto the internet and let's buy a bunch of vitamins because vitamins is where it's at. Well, listen, you're not entirely wrong. You're not entirely wrong. I went and bought a bunch of like an ADHD concoction from Costco. I forget what it's called, but it's essentially just a mega dosing vitamins. And you have to take like 8 of them a day. Well, there was a randomized control trial, which I'll remind you where that is in the evidence pyramid, but up towards the top. And it was a study that essentially said, let's give kids vitamins. Let's give them mega doses of vitamins. Safe, but mega dosing of vitamins. And they gave them vitamins. And this is the actual website of the vitamin company that they use. They're not sponsoring this video. I don't care. I don't take this stuff, but I just thought you needed to see what it actually is. So Daily Essential Nutrients is I think the website. And it's a multivitamin. And what they did was they took this multivitamin, okay, and they gave it to 6 to 12-year-olds. They gave them 9 to 12 capsules a day. Okay. Now this is above the RDA, okay, which is the recommended daily allowance. But it was below the tolerable limits, meaning it wasn't dangerous, right? Because look, if you take a bunch of vitamin B6 or B12, you can get neurologic issues. You can get all kinds of different things, precordial catch, and you can just get stuff. So you don't want to go taking, donkeys levels of these vitamins. You got to know what the top of the barrel is, the top shelf is. But my point is they gave these kids these vitamins, they mega dosed them, but they were still below tolerable limits. And they had a 54% response rate, 54%. Now that's incredible. Okay. And maybe again, it's one randomized control trial. So maybe there's, more that are going to come out that aren't going to show this, but that's up towards the top of the pyramid. And it's a vitamin, right? Vitamins, if you stay below the cutoffs and you obey the rules, it's a vitamin. Like you're not going to hurt anybody with a vitamin if you obey the rules. So this gets a gold bar. Try vitamins, try a multivitamin, right? Try, looking at what's the top end of dosing for a vitamin that you could use, talk to your regular doctor and see if your child responds. I mean, it's certainly not going to hurt anything. Worst case scenario, they just pee it out. Okay, you just give them expensive pee, but it's a thought. And certainly, if we have to choose between a vitamin trial or an aggressive ADHD medication prescribed by me, go with the vitamin. Go with the vitamin. That just trust me. Go with the vitamin. How about this one? Neurofeedback. Let's go get neurofeedback. Hey, I want neurofeedback. Where I got to go to get me some neurofeedback. Let's explain what that is. Here's what you have to understand. Neurofeedback is basically this thing where they put these electrodes, they're monitoring like the electro waves of the child's brain while the child is watching something on the television. Okay. And so on the screen, something would change, like the screen would go dark, and when the child would start to drift off or stop paying attention, and then the child would see this and they would kind of wake back up. And then, the theory is that you begin to train the brain to kind of reactivate itself towards a focus and attention or whatever the skill or strategy is out in front of them over time, right? By kind of doing this, like screen goes dark, brain wakes up, and they monitor the brain waves, and it's this whole thing. Well, you need to do a bunch of sessions. It's anywhere from $800 to $4,000. These are estimates. And what they found with the studies that we've done, as you can see at the highest level, it's no better than placebo. So, I mean, this kid could just be those could just be nothing on his head but some stickers versus the actual intervention, and it didn't make any difference. So at the highest level of support, what I can tell you is this is not probably something you want to spend your time, energy, and resources. This gets an old prospector with a basket full of eggs. Okay. And we know that because we have the highest level of data to support that this is not for you. How about mind body stuff? I like minds. I like bodies. Let's do it. This is yoga, Tai Chi, Qigong. Okay. These are like the movement stuff. People are moving and stretching and doing all the things. This can be really good. This can be super good stuff. Okay. And of course, I'm going to give this a gold bar, even if there's not a ton of overwhelming data. There is some data to suggest that it's slightly better than baseline. Now, again, not overwhelming. Okay. Just because it's towards the top of the pyramid doesn't mean that it's true or that we should all do it. But what it means is what we're able to gather in terms of input and what we're able to synthesize in terms of data would suggest to you that this is probably a little bit better than baseline, and it's certainly not going to hurt anybody. Getting a kid off the couch away from a video game and stretching. Yep. Gold bar every time. Do that. How about physical activity? I mean, this is an easy one. Let's not spend a lot of time thinking about this. The answer is yes. 100%. And yes, there's data at the highest levels to support this. So this is why, kids with ADHD, right? They need to go out for recess. Punishing a child with ADHD by staying in from recess is not advisable. Not a good strategy. They got to get their wiggles out times 1,000,000. Okay. These kids got to keep moving and grooving. So keep them moving at home, keep them moving at school, and you're going to see some benefit. How about sleep hygiene? Let's talk about sleep hygiene. This is another no-brainer. I don't even need to give you any more slides. Kids who don't sleep don't focus. Kids who have obstructive sleep apnea, restless leg syndrome, kids who fall asleep at 10 o'clock in the morning, they don't do well at school, right? Like, when you've got a newborn baby at home, we've got a puppy, I'm up all night long doing something. You're not at your best. Okay, you're not at your best. So it's the same with kids. So you got to get sleep figured out. If I have one thing to target in a child who presents to the clinic with behavioral or learning issues and he or she's not sleeping, sleep's what we do first. You got to get after sleep, because when you do that, everything gets better. How about traditional Chinese or Eastern medicines? And what I mean by that is herbals, acupuncture, massage, or martial arts. Now, I like all this stuff, right? I mean, I'm sure there's got some benefits, but what we need to understand is at the highest levels of support, at the highest level of study, we found that it doesn't play out. It doesn't really seem to have any lasting or replicable benefits, and so it gets a prospector. I'm sorry, you don't get a gold bar there. I'm not saying I hate it. I'm not saying it's bad or wrong for everybody, but I'm saying if you're trying to figure out what to do to help, and your time, energy, and resources don't grow on trees, this is not one I'd have you do. Okay, go get some multivitamins. How about this one? Endeavor RX. This is an interesting one. Endeavor RX is like a video game. Okay. It's a video game. And essentially what it is, it's a go, no go style video game, right? Where a child's playing and they're kind of maybe hitting the space bar, they do different things. And you really have to stay focused, because if you go or you don't go, you fall into lava or something happens. I don't know. I've never played it, but it teaches kids how to maintain their attention over time with cause and effect. A randomized controlled trial, which, as you remember, it's high. That's pretty high up on the list of evidence. 348 kids, so not a small amount of children. They found a small but significant change, right? A small but significant change. Just playing a video game, right? Nobody's manipulating the neurochemistry of somebody's brain. Nobody's doing that. Nobody's going and getting needles put in their back. No one's going and getting, getting neurofeedback or whatever. They're not, spending $4,000 and never going on a family vacation. No one's doing that, right? They're just playing a video game. It's something that kids like to do anyways. This is something I think you can get by going to their website. Your physician or your provider usually will have to fill out a prescription on the website. But in insurance, surprisingly, I think there's coverage options here available. So we like to try this sometimes to see it again. EndeavorRx is not sponsoring this video, but they sure could if they wanted to. How about this? So I'm going to give that. It's a randomized controlled trial, but it gets a gold bar. So that's a keeper. How about trigeminal nerve stimulation? Look at this. This is interesting. Now, this is something when I first learned about it, I thought there's no way. No way. You stick a little thing on the face and it like sends like you can't discern that it's happening, but it's like a sonar pulse or something. And it pulses the trigeminal nerve. And surprisingly, they did a randomized control trial, not a lot of kids, okay? But they found moderate benefit similar to a non-stimulant. So similar to things like Qelbree, maybe Intuniv, Clonidine, Strattera. So similar to things that we would use as a prescription. And this doesn't look, overly invasive. I'm sure there's an expense, but I don't know what it is. I should have looked that up, but I don't think that there's a big expense to this. And it's not a medicine. So, and it's got some preliminary data that says it's fairly equal to some things that we prescribe. So I think, why not try it? That gets a gold bar. Randomized control trial, second to the top level. I think the cost for admission for that is pretty low. It's not a medicine. Why not? So that gets a gold bar. All right, here's our summary. My friends. Let's get serious. So if you're taking screenshots, this is your screenshot right here. So let's go through it. Gold bar interventions for ADHD. Here it is. Remove colorings and preservatives. You don't need me to tell you that. Remove colorings and preservatives. Omega-3s are a yes. Remove sugars is a yes. Vitamins is a yes. Mind-body stuff, yep. I want yoga. I want all that stuff. Physical activity, sleep, EndeavorRx, trigeminal nerve stimulator. Even that might be something worth trying. Things that are on the naughty list, okay? Things that are, let's just say it like this. Things that don't yet have enough data to support their use in the clinical realm. The Feingold diet, right, which is removal of a lot of things from diet, making your life a hard life even harder. Neurofeedback, which you talked about, is no better than placebo and super expensive. And then traditional Chinese or Eastern medicine strategies like acupuncture and things like that. So that is a good overview of the ADHD stuff. One thing I want you to think about. Okay. I want you to think about, if you're like, well, this is another screenshot for you. I want you to ask yourself when you're going through this, when you're on Facebook, you're in the grocery store, or you get something in Facebook ads pops up. I want you to ask yourself, is it sexy? Is it sexy? Is it sexy? Is it safe? Is it easy? Is it cheap? Is it sensible? Is it sexy? I mean, because, at the end of the day, if there's not a ton of evidence to support its use, you better make sure it's sexy. Because golly, why fly to Peru and get stem cells? Why do that? That's going to cost you $20,000. Why go and get chelation therapy? Why do that? Stick a needle in the arm to get the metals out. What metals are we talking about? Like, it's just, if it's not safe, easy, cheap, and sensible, I would suggest to you it's probably not worth it. You can probably skip the evidence pyramid, right? And just say, look, it's not sexy. I'm not doing it. And so, as we get to the end, I want to invite you to some great stuff. Okay. And this is your opportunity as well. If you're watching this live, put some questions up if you have them, and I'll address them right here, right now. If you're watching on the upload, put them up there and I'll see them and we'll address them. Okay. For sure. But let me invite you to some stuff because I think this is fun. I enjoy you. You seem great. The internet's been kind to me. I want to go further, faster. So let's keep going. Let's not quit. Join our very good newsletter. For crying out loud, it doesn't hurt. It actually feels good. It feels good to join it. Go do it. Go click the buttons and type in the thing and we'll send you stuff. The sole purpose of that is to encourage you. That's it. Okay. So why not? We also have other YouTube videos you should really check out. We got a bunch of those that are super useful. And then, again, our whole purpose here is to educate, equip, and encourage you on your journey. And I would love the opportunity to do it with you on a regular basis. I will see you next week. Same time, same place, 9 a.m. Central Standard. I appreciate you. I care about you. I'm going to put on some super amazing 80s music and I'm going to see you.